Hello dear friends, welcome back. We are discussing about the pubic bone, right? So in the previous lecture I have covered about the anatomy and the different parts of the iliac bone. So you can see on the whiteboard we have the theory here, then we have explained it practically in a video, and I hope you have watched this lecture and I hope you remember all these parts which I have mentioned with different colors of the iliac bone, right? Now let me first of all little bit introduce here. This is the iliac bone, this is the ischial bone, this is the pubic bone. Both, all of them combine and they make one bone. This is called the hip bone, as it was mentioned in the previous lecture that this is the hip bone. Now the hip bone, you know, is composed of how many bones? It is composed of 3 bones, right? The first, the larger bone, the flat shaped bone, I have already discussed, which is called the ilium, and we have discussed, we will discuss inshallah the attachments and the muscular attachments and the ligamental attachments to it. I will discuss inshallah in a big detail. First of all, we will discuss about all the 3 bones of it, right? Now we are going to discuss about the pubic bone, which I have drawn here, and I will show you also in this model. So the pubic bone is the second bone which makes your hip bone, right? So pubic bone, and pubic bone is the smaller bone among these 3 bones, right? Among these 3 bones, the ilium, the ischium and pubis, right, or pubic bone, among these 3 the pubic bone is the smaller bone, right? And it is the anterior bone. You know, this ilium is superior, right? And this pubis is a little bit anteriorly. If you see in this model here, look carefully my dear friends, we keep it like this, right? So this is the ilium, both of them which I am holding, ilium. Then this is, which is anteriorly, anterio-inferiorly, right? We say anterio-inferiorly, this is 2 pubic bones, and posterior-inferiorly, right? Posterior-inferiorly, these are the ischial bones. We will discuss these ischial bones in the next lecture, right? So look carefully. Your pubic bone is actually composed of 3 important parts. What are those parts? Let me name them here. First, from here, right, up to here, this part of the pubic bone is called the body of the pubis, right? So what is this? This is the body, and we will discuss the parts of the body in, right now. Then this part is called the superior ramus, right? Superior ramus. So from here up to all this part, superior ramus, and this part is called the inferior ramus. Inferior ramus, right? Now look carefully what I am going to tell you. The interior or the body makes the pubic symphysis joint, right? And the superior ramus will combine with, look here, look here, look, this is the here we have, this is the body, right? This is the inferior ramus, this is the superior ramus, right? But now the superior ramus will go backward and upward, right? It is going backward and upward and will join the ilium and ischium at the acetabulum, right? So the superior ramus, when it goes backward, it makes its part in the formation of acetabular fossa or acetabulum, right? So this part is called the superior ramus. This is the body, and this part is called the inferior ramus. Now look carefully, the inferior ramus will join the ramus of the ischium bone, and they will make the ischiopubic rami. They will join and they will make the ischiopubic rami. So both rami will join here. This is called the ischiopubic rami, right? So this is inferior ramus, superior ramus and body. Now let's see some features of all these 3 parts here. Look carefully. First of all, I will write here, first it has a body, right? Then we know that it has a superior ramus, right? And then we know that it has an inferior ramus. These three are the most important parts of this pubic bone, and we have some very good books, but one which I like the most, as you will see here in my hand, I am holding it, Beauty, the most beautiful book which writes everything about the human body. So the body, the superior ramus and the inferior ramus. Now look carefully. The body has certain different parts, right? The body of the pubic bone has certain different parts. And what are these parts? So these parts are, first of all, it has a crest which is called the pubic crest, and I will show you in the video which we will apply, which we will see, which we will discuss there, the bone itself. So pubic crest is there, right? Then there is pubic tubercle, right? The important markings which are present there in the body, right? So pubic crest is there, pubic tubercle is there, and the third one we have the medial surface, we have surfaces, right? We have surfaces. And how many surfaces it has? The body of the pubic bone has 3 surfaces. And what are those? Those are, the first one is your surfaces. So the first one is the anterior surface. Then we have the second one is your posterior surface. And then we have the third one, which is called the medial surface. I will show you them in the bone, the real bone, right? So there is the anterior surface, the posterior surface, and the medial surface is there. Okay. Then we say this posterior surface is also known as the pelvic surface. So let me write it also here. This is also known as the pelvic surface. Why? Because it is towards the pelvic cavity. That's why we say that it is the posterior surface is also known as the pelvic surface. Why? Look carefully here. Look, this is the posterior surface and it is present towards the pelvic cavity. That's why we say this is the pelvic surface. And this anterior surface, right? This medial surface is also known as the symphysial surface, right? This is also known as symphysial surface. Why? Because this surface is responsible to make the symphysis pubis joint. Look carefully here. Here we have this bone, right? This is the posterior surface, right, which is towards the pelvic cavity. That's why we call it the pelvic surface. And this surface, right, this surface is making the symphysis pubis joint. As if we have here the other pubic bone, right, so there will be the pubis of that bone, so they make the symphysis pubis joint, which we have it here. Look, this is the symphysis pubis joint. So that's why we say that this anterior surface, this medial surface is also known as symphysial surface, right? So these are the important parts of the body. The body has a pubic crest, which I will show you there. The body has a pubic tubercle, which we will see. And the body has surfaces, the 3 surfaces, the anterior surface, the posterior surface, and the medial surface. Okay, friends, we will see them there. Now, there is superior ramus, right? And I have shown you the superior ramus there, and let's see it once again. This is called the superior ramus, right? This superior ramus has certain important parts. And what are those parts? So this superior ramus has surfaces and borders. These 2 important parts that it has. It has surfaces and it has borders. I hope you are understanding me. So surfaces, how many surfaces? It has 3 surfaces, so simple. And how many borders it has? It has 3 borders. And let's see these 3 borders first, then we will say about the surfaces. So the first border, right, is called the superior border. superior border. Then there is anterior border. The third one is the inferior border. So simply, right? So how many borders does the superior ramus of the pubic bone has? It has superior border, it has anterior border, and it has inferior border. Now the superior border is also known as the pectineal line, right? We call it the pectineal line. I will show you in the video regarding, while we in the next video we will discuss the bone, so I will show you all these. The superior border is also known as the pectineal line, and the anterior border is also known as the obturator crest. Obturator crest, right? So these two borders are also named as pectineal line and obturator crest. Now we have two surfaces, three surfaces. There are three surfaces which your superior ramus of the pubic bone has. And what are these surfaces? These surfaces are the pectineal surface, pectineal surface. Then there is the pelvic surface, and then there is obturator surface. Yes, obturator surface. So how many surfaces? Pectineal surface, pelvic surface, and obturator surface. This superior ramus has the pectineal surface, right? Then there is the obturator surface, right? And then there is the pelvic surface, pelvic surface, pectineal surface, obturator surface, right? Done, friends, done. These were the two important parts of the superior ramus. Now the inferior ramus is not discussed too much, right? Rather we say that this inferior ramus actually is present inferiolaterally. It is present inferiolaterally, right? And this superior surface is present superiolaterally, right? Superiolaterally. And this body is present totally anteriorly. Anteriorly, right? So we should remember also this: anteriorly, superiolaterally, and inferiolaterally. Inferior ramus of the pubic bone will join. Look here, friends. The inferior ramus will join the ramus of the ischial bone, and they will make the ischiopubic ramus, right? We don't say anything else about it. The book says that it just makes the ischiopubic ramus. Ischiopubic ramus. Why? Because we say that, look carefully, friends, look carefully. We say that this inferior ramus goes, we keep it like this. So this inferior ramus goes backward and little upward and makes connection with the ramus, with the inferior ramus of the ischial bone, and they make the ischiopubic ramus, right? So these were some important points regarding the pubic bone. Now let us see all these parts in a video on the bone itself. Thank you so much.